Hello, and thank you for joining the American Society for Microbiology today for a special discussion focused on the intersection of science and policy when it comes to addressing influenza. My name is Stefano Bertuzzi, and I am the Chief Executive Officer of the American Society for Microbiology, ASM. I'm also pleased to serve as a member of the Executive Committee of the Coalition to Stop the Flu. And ASM is one of the world's largest life sciences societies, which is dedicated to promoting and advancing the microbial sciences. And in this capacity, we're very proud to be among the founding members of the Coalition to Stop the Flu, which represents the full spectrum of stakeholders in the influenza ecosystem. So we hope to make a difference in moving the ball forward in this very important field. We are holding this discussion today at the start of the 2021-2022 flu season, while we continue to grapple at the same time with the COVID-19 pandemic. We have a lot in our hands. We are at a particularly important inflection point at which we can learn now from the experience over the past 18 months with the novel virus that has claimed more than 700,000 American lives and over 4.5 million lives around the world. I'll say this again, 700,000 American lives and 4.5 million lives in the world. Think about these numbers. It's incredible, and it's really heartbreaking. Through our successes and also our failures to combat the COVID-19, we can determine, I am sure, that there is a lot that we can learn on how to better fight the flu as well, which is persistent annual threat, significant threat to human health. And as we learn, it's not just a health issue, but it's also an economic issue because the two things are really intertwined. The Centers for Disease Control and Prevention estimates that each year the flu results in a number of illnesses, which is staggering, and it ranges from 9 to 45 million, resulting in a range of hospitalizations, which goes from 140,000 to over 800,000. And if we look at the death toll of the flu, it ranges from 12,000 to over 60,000. And what is really, really painful is also to flag among these deaths, the almost 200 pediatric deaths that we see. We can do better. And we can, thanks to science and thanks to policies. And this is what we're going to be addressing in this panel today. So I'm really honored to have two distinguished experts to me that will help us cover both of these aspects on how to fight the flu. To my left, at least on my screen, is Dr. Stacey Schultz-Cherry. She is a world leader in studying influenza, and she is a full professor, or in her institution, St. Jude, is called full member. And so, Senator Daschle, you may have competition here in terms of titles. She is in the Department of Infectious Diseases at St. Jude Children's Hospital. So thank you, Stacey, for being here. And I also would like to point out that Stacey serves as chair of the ASM Public and Scientific Affairs Committee. Senator Tom Daschle had a distinguished career in public service spanning 3 decades, and including serving as the minority and the majority leader in the U.S. Senate. And we thank you for your service and for having made such a big difference for the country and for the world. And now also serves as chairman of the Coalition to Stop the Flu. So we're very excited to meld together today the expertise of these two wonderful leaders. Our conversation will explore over the next 30 minutes or so how we can harness the opportunities that scientific advances present to us, and how can this inform policy, and how we can get policies in place that will help provide evidence for our effective public health infrastructure and for the development of initiatives that could tackle the flu menace in a more effective way. So without further ado, welcome Dr. Schultz-Cherry and welcome Dr. Senator Daschle. So I'll go to my very first question. And in this first question, I'd like to cover why does it make sense to talk about the flu today as we are in the midst of a pandemic caused by a very different virus? And so don't we have enough? Do we really have to worry about this as well? And why flu? Is there anything else we should be focusing on instead? Why is it so important that we address flu as a public health threat? So I'd like to start with Dr. Schultz-Cherry. And if you could tell us, Dr. Schultz-Cherry, about what influenza is, and can we ever get rid of the flu? And why is it so unique, or why it's not so unique? So thank you.
Thank you, Dr. Bertuzzi, ASM, and Senator Daschle for the opportunity to provide some education on influenza virus. We can't forget that influenza season is starting, and we're already starting to see cases despite the ongoing SARS-CoV-2 pandemic. So to start, we need to think about influenza. It's a zoonotic virus. That means it circulates in animal reservoirs and occasionally jumps between animals and into people and then can circulate in humans. This what causes influenza pandemics. However, even once influenza is within people, it can change as it spreads through humans or animals, forcing us to monitor these changes and often update the influenza strains in our vaccine. This is similar to what we are seeing with SARS-CoV-2 and the emergence of all the different variants. The difference is flu is even better at producing these variants. So will we ever be rid of it? Probably not. The host range is too large, meaning there's too many different animal populations that can get infected with flu, and the virus is endemic in its reservoir, which are wild birds. That is something that's unique to flu, as well as its ability to rapidly mutate. It's actually better at changing than SARS-CoV-2 is. So how is it not unique? As we've seen, the fact that there are zoonotic viruses, meaning these viruses that reside in animals but can occasionally infect humans, is not unique to flu. This highlights the importance of increasing studies at really that animal-human interface as part of pandemic preparedness and response.
Thank you so much, Dr. Schultz-Cherry. This is really a very complex picture that you're painting for us. And I'm sure, Senator Daschle, that these are exactly the reason that you had in mind when you thought of building a coalition to fight the flu. So I'd like to hear from you what you think are the policy needs that needs to be addressed with respect to the flu to tackle this very complex disease. And also, don't we have all that we need? Flu has been around for a long time. So what do we need?
Well, first of all, let me just thank you both for your leadership and the commitment that you've made to these challenging aspects of our circumstances in health these past months. I especially have appreciated ASM's involvement in the coalition right from the very beginning. So I'm just delighted to be here today, and want to thank you both for your commitment and the services that you have offered in this challenging effort. I come from this from primarily a policy perspective, and so your question is a good one. I think we all recognize, as a result of the devastating experiences that we've had now in these last 18 months, that we really, as a country, need to focus from a public policy perspective on two aspects, both seasonal and pandemic. But unfortunately, I think from a federal government perspective, the sad reality is we don't handle either of them nearly as well as we should. You've so effectively already characterized the devastating consequences of the deaths that we have experienced, both in terms of the pandemic as well as with influenza. 60,000 a year, scores of pediatric deaths, and that isn't even counting the thousands of hospitalizations and millions of illnesses. So the consequences of all of this couldn't be overemphasized. And even though flu is one of our most predictable public health threats, I'd argue that the federal government doesn't treat this threat with the urgency that it deserves. And then from a pandemic perspective, it's clear that our country remains dangerously unprepared for an influenza pandemic. So we've seen the consequences of this lack of preparation. And I only have to wonder, as we compare our experience to the one 100 years ago, where we've now even surpassed the 675,000 Americans who died in the 1918 influenza pandemic, I wonder how much worse the 18 flu pandemic would have been in today's hypermobile society. Unfortunately, the one thing that we can be certain of is that it's only a question of when, not if. And I'd really emphasize that. It's a question of when, not if, the next pandemic arises. And that's the reason the Coalition to Stop the Flu came together. We're very hopeful that we can continue to make progress towards ending flu deaths in our lifetime. And I believe, while it's admittedly a very lofty goal, I think it is possible with sufficient funding, prioritization, and together with the great work of ASM and its members and other scientific communities working together to accomplish that task. It can be done.
And thank you for your leadership among all the portfolio of activities that you could take on. We really thank you for focusing on this particular one, which is so important. I'd like now to shift to the hot topic of vaccines. And I'd like to start again with Dr. Schultz-Cherry. Each year, we work to develop an effective flu vaccines. And I think for the reason that you described before, each year the vaccine needs to be different. There is a guessing game that goes on here. So what, from your perspective, we can do better to improve the annual, for the seasonal flu, the vaccine that can be administered to people?
Yes, thank you for this question, Dr. Bertuzzi. I think it's really important that people hear about the updates. It's really very exciting times for influenza vaccines, much of it due to the success of the different platforms of the SARS-CoV-2 vaccines. So there are many strategies underway to improve the effectiveness, how long-lasting your immunity is after vaccination, and even how broadly protected you are from vaccines. Meaning not just being protected with the variant that's circulating, but future strains. Some of these initiatives include new vaccine platforms like mRNA, recombinant protein, nanoparticles, so very much moving forward away from what has always happened, which is growing that virus in eggs, which can cause mutations or changes in the virus that make it less effective when we use it. But I think even more important, it includes better actual design of the targets that we're trying to hit with that vaccine. We're going after multiple targets, multiple parts of the virus to generate a much stronger immune response, including T cells. So not just antibodies, but other arms of the immune response that are so critical for protection from both getting severe disease as well as infection. The use of adjuvants is also going to improve our arsenal against influenza. Continuing to work with modelers to improve our understanding of how influenza changes is absolutely crucial. So it becomes much more of an educated guess when we're deciding on those flu strains. And there's a lot of work, really a group worldwide that has developed an influenza vaccine roadmap that outlines how we plan to move forward, the different things that we have to hit on in order to have improved seasonal and eventually universal flu vaccines.
Yeah, that's wonderful. I think it's so important what you said about emphasizing how the basic science that has developed those platforms allowed, first of all, in the rapid development for the COVID-19 vaccine, but also how this is influencing, and this platform and technology can help for influenza as well. And so very, very exciting. Senator Daschle, earlier this year on this front, the Department of Health and Human Services deployed the National Influenza Vaccine Modernization Strategy. What is it exactly, and what is it so important to this effort?
That's a good question. The National Influenza Vaccine Modernization Strategy, or we commonly refer to it as NIVMS, began in the Trump administration and obviously has now continued with President Biden. And I think in this deeply polarized environment that we continue to see our countries endure, it's a good example of a strong public policy that actually transcends partisan divides. The NIVMS is centered around three basic strategic objectives. The first, strengthening and diversifying influenza vaccine development, manufacturing, and the supply chain. Second, promoting innovative approaches and use of new technologies to detect and prevent and respond to influenza. And then third, increasing influenza vaccine access and coverage across all populations. I think in spite of the name, NIVMS also looks beyond vaccines actually to other critical components of preparedness and response, including diagnostics and therapeutics. The coalition supports this broad vision and has urged the administration to prioritize the strategy and funding for its implementation. And we were pretty pleased, actually, that funding to implement the strategy was included in the president's budget request. And now we just hope that Congress answers this call. That's the key. The federal government has an important role to play in funding and facilitating research needed to continually improve vaccines and other preventatives and diagnostics and therapeutics. And I'd say even more importantly, the federal government plays a vital role by working to ensure access to all these products and communicating with the public and providers every flu season.
This is very exciting. It's a very, very exciting plan, and so good to see that. Again, healthcare interventions and research, at least some parts of them have bipartisan support, and they continue in this light. So important. We can't be our own worst enemies, right? And so that's very important. Let's shift to lessons learned from COVID-19. And last year was an incredibly unusual pattern for the seasonal flu, in the sense that it was extremely low. And while there are different explanations and experts, bring forward different theories why that is, one of the possibility is actually that the non-therapeutical intervention that were deployed, like social distancing, wearing masks, so the behavioral aspects, which also happen to be the least expensive one. It requires people to modify their behavior, not easy, as we have learned, but certainly something that can be done in the developed world, in the developing world, with much more ease. And so, Dr. Schultz-Cherry, what can we learn from what has happened, and from both the, I would say, pharmaceutical, but also the behavioral intervention that could be applied to the flu?
Yeah, thank you for that question, Dr. Bertuzzi. It's great opportunity to reflect on what worked and what didn't. I think one thing that really worked well is that and demonstrate that coordinated efforts for vaccine development and assessment, as well as rapid genomic surveillance, works. When we all come together as a community with committed funding, strong partnerships between the government, industry, academics, and public health professionals, we can quickly rally and combat a situation. Adopting this approach, especially a bottoms-up surveillance in communities, would be invaluable in disease detection, control, and protection. I think another lesson learned is the power of having diverse vaccine platforms, potentially that might be needed for different populations. So it may not be one shot fits all. I think another thing that really came to the forefront is that we need much more work in the area of developing new antiviral as well as antimicrobial measures. I think we're very lucky that with SARS-CoV-2, we didn't see secondary bacterial infections like is more common with influenza virus and is often the cause of the high morbidity. I think losing many of our antibiotics to resistance could become a major problem with the flu pandemic. One thing I think it's important to note is that all countries developed influenza pandemic preparedness plan, really in response to the avian flu infections that were happening and are still happening, but started in the early 2000s. Perhaps we should also ask, what could we have learned from flu for the SARS pandemic, but did not execute?
Exactly. Yeah, this is really the sad part, right? While experts have been, as also Senator Daschle was mentioning, have been saying, hey, this can happen, but the world was paying no heed here. And so this brings me to Senator Daschle, and what can we do from a policy perspective to build on these lessons and missed opportunities that we had in the past?
Well, I'm sure we all hope that closed schools and social distancing never have to happen again. I'm dubious about whether we can look with any confidence to that goal, but that is our hope. But I think we can take other important lessons from COVID that are broadly applicable to influenza and other infectious diseases. And I think I'd point to three critical lessons. First, there is no substitute for preparation. Our country has long taken a reactive rather than a proactive stance towards pandemic preparedness. This means that when a crisis arises, we scramble to put funding and personnel in place. But a pandemic response is not simply a switch you can turn on and off. We need a strong public health infrastructure. We need disease surveillance capabilities. We need partnerships with diagnostics and drug manufacturers. We need agile and responsive federal agencies with clear roles and responsibilities. And we need strategic plans that can be taken off the shelf and actually executed. 18 months after COVID began, I fear we've made only incremental progress in any of these areas. So that's the first lesson. I say the second and related lesson is perhaps an obvious one, but it is that state and local governments are vital partners in infectious disease management. We're currently paying the price for years of underfunding state and local public health departments and laboratories, and I worry about what will happen when the COVID response funding runs out. This is exactly what happened after the H1N1 pandemic and contributed to the situation that we're finding ourselves in today. And third and finally, just as the federal government needs state and local governments, the federal government needs the private sector as well. Too often, during the COVID response, the federal government was too late or too conservative about engaging the private sector on things like testing and therapeutics. Infectious diseases impact us all, and the private sector is critical in both preparedness and in response.
Yes, very, very powerful. And essentially what you're telling us, Senator Daschle, is that hope is not a strategy. And for the things that we need to prepare, we have to prepare. And this is a mix of things. For example, you mentioned diagnostics. I think that is very, very important. ASM is very focused on diagnostic, and especially at the beginning, but at the beginning of the pandemic or of an outbreak in general, diagnostics play a very, very important role, because when you don't have a therapy, at least being able to detect the infection and put in place the intervention that are available and be prepared to do that in a plan, that is very, very important. And we've seen how all this did not happen in the beginning, and the broken supply chains for all the PPEs and for the diagnostics, and has been incredibly painful. And so this is why I think that science and implementation of science through the right policy and the right preparedness is so important, because if we have all the scientific advances that we need, but we don't know how to deliver that science, practically to the people wherever they happen to be, it's really not that worth it, right? And so the shipping and receiving for healthcare and for science very important department. And so this is why I really call, in our actions, either to the coalition and others, for really having all the stakeholders, the industry in different areas, and also the scientists to work together, because just being separated and doing our own job without, integrating through policies, this won't get us there. So thank you for making that point. I think it's so crucial. Let me now move to the to what have we done well? What are the advances that have happened? And Dr. Schultz-Cherry, there's been a lot of research going on in flu, and we, especially a few years ago, we heard a lot about the universal flu vaccine. So let me ask you, why is it taking so long? As it is so complex, but wouldn't it be easier to have one vaccine for flu that could cover it all? And we have to reduce the guessing game. And there was a lot of hope in this direction. So what progress have we made, and what roadblocks do we need to remove?
Right. Thank you for that question. So first, what have been the most significant advances in the decade? I think one thing is really more rapid and affordable genomic sequencing, with data being shared in public databases like GISAID and made accessible to everyone, has really been a game changer to understand how the virus is evolving and what we need to do to really combat it. We not only need to encourage this to continue, but really enhance those efforts. Thinking about the vaccine side, development of flu block, which uses recombinant protein rather than eggs, has been an important step forward. But to get to your main question of why is the universal flu vaccine taking so long, there's many reasons for that. Flu is a tough one to control. As we talked about, it evolves or changes very rapidly. It has many different animals that it can infect and potentially spill over from these animals into people. And we have to fight immune history. What do I mean by that? Well, nearly everyone has been infected with or vaccinated against flu, and you develop an antibody response to these. These antibodies that are developed actually imprint or make a roadmap for how you respond to future exposures to the virus. This is not a problem we had with SARS-CoV-2. Nobody had seen this virus before. Everyone was a blank slate. So this makes it harder to develop a vaccine to something that you already have immunity to. We're also dealing with a changing population. People are getting older. There's more metabolic syndrome or health issues, making people more immunocompromised. This definitely has an impact on how your body responds to a vaccine or infection. And finally, as you said, or Senator Daschle said, you need that continual support and funding in order to really develop these new technologies. And unfortunately, many influenza people have been pulled to work on SARS-CoV-2, as you can imagine.
Yeah, lots going on and lots to do. And I think that that's the same on the policy side, Senator Daschle. A lot has happened. Do you want to help us highlight what has happened that has been very helpful to move research and interventions forward from a policy perspective on the flu?
I think that's an important question because as dire as we might describe circumstances, there are things that have been done over the past couple of decades that I think are encouraging. A number of critical steps have been taken to improve our preparedness. I'd say one of the most important of all was the creation of the Biomedical Advanced Research and Development Authority, or commonly referred to as we do with BARDA, in 2006, now 15 years ago. BARDA is, of course, the primary entity tasked with the development and procurement of medical countermeasures, including countermeasures for pandemic influenza. And it could be argued that they are the most important agency the public has never heard of. Unfortunately, BARDA has been drastically underfunded since its creation. And in many ways, we're now paying the price for that short-sightedness. Another important milestone was the creation of the specific budget line for pandemic influenza work at BARDA in 2008. Prior to this time, pandemic influenza was funded solely through a one-time emergency funding after a crisis. And when this funding dried out, so did the work. To continue to expand on this progress, we need exactly what has been successful in the fight against COVID. We need increased funding and prioritization for the development and procurement of novel and improved influenza preventatives, vaccines, therapies, and diagnostics. We also need funding for the nation's public health infrastructure, which has been almost criminally neglected for far too long. The best vaccine, diagnostic, or therapeutic in the world is useless if it never gets to the patient. So it's critical, however, that this funding be sustainable. For far too long, Congress has worked on a cycle of what I refer to as panic and neglect. Perhaps it goes without saying, but this is a bad recipe for public health.
Indeed. We just need to pay attention. It's not like flipping a switch, as you said. We can't just do it that way. I think in closing, I'd like to address, if you allow me, a little bit the elephant in the room. I'd be remiss if we don't go to vaccine hesitancy. We have shown how wonderful scientific advances have helped us develop vaccines. Effectively, the policies that were put in place in a very bipartisan way by the Trump administration and then continued by the Biden administration. Yet there is a very widespread hesitancy in vaccinations. And for the flu, there's probably something that we can learn from what we're seeing with COVID-19 even here. So Dr. Schultz-Cherry, what do you think, or same question to both of you actually from your different perspective, what do you think can we learn or what can we do to help instill confidence in the safe and effective flu vaccines going forward?
I think this will be the most critical hurdle to overcome. This and improving the health disparities that really have become very evident during the pandemic. We need to do a better job educating people about vaccines, how they work, what goes into the shot, what doesn't go into the shots, more outreach like town halls, social media where we discuss really the risk-benefit analysis of infection versus vaccination. For example, telling people about the long-term complications of getting just flu or no big deal SARS. We need to get the vaccines into the communities in our most vulnerable populations and include community leaders in these efforts. Finally, we need to find a way to combat the spread of false information and regain the trust of the general public.
Senator Daschle?
Well, I agree completely with Dr. Schultz-Cherry. I just add, I think the federal government needs to ensure that its messaging is clear. For every year, there's obvious, and I suppose you could even expect confusion and misconceptions that unfortunately aren't always addressed adequately. As one example, too many in the media fixate on vaccine effectiveness or effectiveness against infection versus effectiveness of vaccines against severe illness or hospitalization. If the average American understood that a flu shot dramatically reduces their chance of becoming severely ill or hospitalized from flu, we might see vaccination rates actually increase. As another example, far too many people falsely think that if they haven't gotten vaccinated by December, it's too late to do so, again, reducing the number of vaccinations. And finally, I think CDC's changing guidance can create confusion. Despite CDC recently announcing that flu shots can be co-administered with COVID booster shots, I've heard multiple anecdotal reports in recent days of people being turned away from pharmacies for their flu shots and being told to wait 14 days after a COVID booster. So the federal government needs to do a better job of talking to the public and providers and avoid these mixed messages. I'd say finally, we need to learn to meet people where they are. For many individuals, the federal government is not the right messenger for medical advice. For every good reason, the federal government needs to expand its efforts to partner and empower trusted messengers who can meet patients in their communities and better address their hesitancies.
Thank you. Thank you so much. This is a very insightful and wonderful conversation, and I'd like to continue for the next 12 hours talking with the two of you, but unfortunately we are up against time. And I'd like just to bring forward a reminder to all of us, and it's something that we microbiologists know well, and the world has learned perhaps only recently. And the fact is that microbes know no borders, and that the havoc that a tiny virus can create, at a global scale is just incredible. So I'd like one word from each of you, and we can start with Dr. Schultz-Cherry, who actually is also has a role at a global level as deputy director of the World Health Organization, collaborating with the interstudy of the ecology of influenza in animal and birds. So from your global health perspective, what would you say that it needs to happen, to tackle the issue, not just at a national level, but at a global level? We can't put out a fire just in one room when the whole house is on fire. What do we need to do?
One word?
Or short?
But 2 words. Education and preparedness.
Education and preparedness. Thank you. Senator Daschle?
Well, I'm going to take that invitation and use my acronym, RICE. That's one word. RICE stands for resilience. We need to be resilient during these challenging times. The I is innovation. We have to continue to innovate, both in the public and the private sector. C, we need to collaborate. We need to work together to do, and that's really what the coalition is all about. And E, we need to be engaged. We need to be engaged in the public policy, in the science, and in all aspects of this effort. RICE, that's my answer.
I'm going to change my answer to rice. That was great.
That's one, and it's also a very healthy food that feeds large fraction of the world. So let's use rice also for pandemic preparedness and seasonal flu curbing. Wonderful. Thank you, both of you. It's been a delight and an honor to be here with you. And thank you both for all that you do on the world stage and providing your leadership in science and in policy to address these daunting problems for humanity. With people like you, we're in good hands. Thank you, everyone. And thank you, everybody who tuned in to listen to this wonderful conversation.